Hi, my name is Dr. Peter Chira, and I'm a pediatric rheumatologist. I'm one of the many doctors that help to manage and treat juvenile arthritis. Some of the other doctors that you may see are your pediatrician or family doctor, an eye doctor that's called an ophthalmologist or optometrist, a kidney doctor that could be a nephrologist, a nerve doctor that could be a neurologist, or a skin doctor called a dermatologist. You'll probably also see other therapists, including physical therapists or occupational therapists, and sometimes you'll even see a psychologist to help you with your management of your juvenile arthritis. Today, what I want to do is go over what you need to prepare for a visit at the pediatric rheumatologist. My friend Rosie Panda is bringing her friend Wasabi to the pediatric rheumatologist today. And to get ready, we're going to help her with a list of items that could be useful at the clinic visit. These are some of the items that Rosie has prepared for Wasabi's visit. They include getting a mask, bringing comfortable clothes or shorts for the visit, a snack, bringing medicines for Wasabi, questions for the doctor, and something to do while waiting for the doctor. Let's see what Rosie and Wasabi have gotten together. Looks like she has a mask for Wasabi, his medicine, a snack. Wasabi likes bamboo. Questions for the doctor, and his favorite book. So it looks like on the checklist, Wasabi has his mask, his snack, medicine, questions for the doctor, and a book. He doesn't need shorts right now because he doesn't wear clothes, but I think you guys should bring some shorts if you come to clinic. You may notice when you finally get to clinic, things are a little bit different at clinic. One thing that you'll notice is that you're going to be asked questions about whether you're feeling sick right now with fever or stomach ache or other problems because of the COVID-19. You'll also notice that everybody's going to be wearing protective equipment, including masks and eyeglasses. So hopefully you're not going to be afraid of everything and all the changes that are going on in clinic. Pretty much everything else will be the same. One of the first things that happens when you come to clinic after you check in is you get your height and weight done, as well as your temperature and blood pressure check. Here, Wasabi's getting his blood pressure checked, and sometimes some kids don't like it because of the squeezing. It shouldn't hurt and shouldn't last for very long. Rosie and Wasabi are now in the room. The MA will check on medicines and other items. This is a good time to get a snack and read the book. After Wasabi and Rosie get settled in the room, the next thing that we do is just ask questions about how Wasabi's doing and going over the medicines and other things that may be going on that may help me decide how we're going to manage his arthritis. Then we end up doing his physical exam. Now we're going to look at Wasabi from head to toe. We'll do many of the same things that his regular pediatrician would do in their office. The first thing we're checking will be his ears and making sure that there are no problems there. Then we're going to look at his mouth. The next area that we focus on are his eyes. Because patients with juvenile arthritis can have problems with their eyes, we do a careful exam. But often we also have an eye doctor help us out by doing an examination on them at a different time. The next area that we're going to check are Wasabi's lungs. Wasabi's doing a great job by taking nice deep breaths so we can hear that there's no problems related to his arthritis with his lungs. We now move on to Wasabi's heart. We want to make sure that the rhythm's okay and that he's not having a fast heart rate. We now focus on Wasabi's belly. We want to make sure his intestines, stomach, liver, and other organs inside his abdomen are all okay and there are no problems from medicines. Finally, we move on to the joint exam. We look at Wasabi's neck and making sure that it can move up, down, side to side, and usually we also rotate as well. We now are focused on his shoulders. We want to make sure that he can extend it back, move it up and down, and also rotate. We now move on to the elbow, making sure that he can flex and extend it normally. We move the wrist up, down, and side to side. Unfortunately, we can't show you all of his finger joints, which we would normally do in clinic for you. Now we move on to the lower part of his body. We move his hips, making sure that they can flex, extend, and rotate normally. We move on to the knees, making sure that they can flex and extend to straight. For his ankles, we do up, down, side to side, and cannot show his toes. Finally, we have him stand up and touch his toes to look at his back. Sometimes we'll make you walk. As you can see, Wasabi's visit's gone great. His physical exam did not show any signs of active arthritis, and he didn't tell me anything was going on at home to make me worried that we need to make adjustments with his medicines. Hopefully this video will help you prepare for your visit with the pediatric rheumatologist. Remember to use that checklist that Rosie and Wasabi used as well. And maybe next time your visit will go as quickly as Wasabi's visit went. Hope you enjoyed the video. I want to thank Wasabi and Rosie for helping me out. Have a good day.